So let's move on to the next segment. How do we reignite community support through outreach marketing? In fact, I want to talk to you about 10 projects, 10 outreach initiatives that will help you win back every single patient. Number one, I just talked about, and that is the safety ambassador concept. And this is something, by the way, that can be implemented and happening within 4 weeks from the moment you say, let's go. Number two, one of the things I like to talk about in healthcare is perception equals deception. The way we see ourselves may not be the way our patients, their families, the community see us. Now, there's an old cliche, you never get a second chance to make a positive first impression. Well, here's my question. What first impression are you making now with your entranceway? Is it a welcoming place or is it a barricade? Which is it? My question is, would you rather meet a monster in a hazmat suit or somebody wearing a friendly badge with a photo and a big smile, or a mask that's got a smile built into it? Would you rather meet a group of individuals that look like they're from Mars or happy smiling pictures welcoming them? So I actually have a mask that has my smile on it, and it kind of makes me look like Shrek, but the smiles that I get from people when I wear it are incredible. And now we have see-through masks, we have see-through material masks, we have all kinds of things. My good friends at Spring Hill Medical Center had a contest, and they had 100 caregivers submit photos that were friendly. And the winner was Karen. And Karen had a picture of her and her puppy. And on the flip side of the photo, she had one that made her look like a bit of a monster with a needle. So cute. Kids loved it. Puts a smile on people's face. And it says, we are human just like you. Now, here's my question. How easy is it for patients to navigate access to your hospital or to your clinic? Let's assume they're reluctant to begin with. Unless they're coming to us from a tummy tuck, a facelift, or deliver a baby, they don't really want to be there to begin with. So I want to share with you a video of a colleague and friend who tried to gain access to her hospital. And here is her experience.
At 3:45 p.m., I arrived at a local hospital for a scheduled scan in the radiology department. I was previously told by staff to enter by the ER doors. I went to the ER doors. There was a large sign posted outside, actually standing, stating, no one enter through the ER doors, everyone, except for ER patients, everyone else go to the front lobby doors. I walked to the front lobby doors. A sign was posted there. After 3 p.m., everyone enter through ER doors. So back to ER I go. I go back to radiology department. I was told I had to register. Previously on the phone, staff had told me, no, I didn't have to register. Come straight back to radiology. So back to the ER I go. After a short wait, the staff member at the ER says, no, you have to go to the lobby to be registered. So I go to the lobby, I am registered. Back to radiology, the scan was completed. As I'm leaving the room, the exam room, I go to use the hand sanitizer that's mounted on the wall. Batteries were dead. Hand sanitizer didn't work. So the conclusion of that visit was a terrible experience, as I shared my personal hand sanitizer with the tech who performed the scan on me.
Wow, what a story. What a cautionary story. Now, here's what I know. That hospital is a hospital that cares about their patients. They have an excellent patient experience initiative. The challenge is they had not yet given thought to coordinating access in an era where it's complicated to get in. Second idea that we want to recommend is to appoint a task force called an Easy Safe Access Task Force. Let's bring our people together. Probably we could do this in a couple of weeks. Coordinate all the regulations and protocols and rules and simplify and make it easier for our patients to get in. And of course, use photo badges as well. Thirdly, third project I want to recommend is the use of safety sentence starters. A sentence starter is just a nice way of communicating. We've got 100 different ways we've made this place safe for you. We are the safest place in town. And how to engage greeters and staff on the units and phone receptionists and nurses doing triage in the ER, and everybody, including the clinics everywhere, in using words that welcome and make people feel comfortable and safe. Let's make sure we stop calling entrants screeners and let's call them greeters. And let's educate them about how to communicate. Welcome to our hospital. So glad you've chosen the safest place in town for your care. Listen, hospitals are a whole lot safer than the grocery store. Number 4, how do you communicate to the public that we're safe? Well, giving them a brochure they're not going to read. Give them a list of 300 rules, regulations, and protocols you're guiding by. Nobody's going to look at that. How about this? Why don't you accept our recommendation to appoint a small team of frontline staff and a couple of managers to record a 3-minute video called 100 Reasons Why We're the Safest Place in Town. Bang, 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 bang. You cover a lot of great ideas. You put it on your website, on Instagram, on YouTube, on Facebook. Something like that's going to go viral. Idea number 4, pick a fun theme, make it a giggle, but get across a very serious message. Number 5, let's start showing instead of telling. So on a little bit more serious note, I want to recommend that you engage half a dozen of your leaders to record a mini documentary virtual safety tour. For example, have your chief nurse officer explain why the med-surg unit, an ICU, an OB are safe places. Let's get your environmental services leader to talk about cleaning and safety. Let's get your outpatient champion to communicate what you've done to make it a positive, safe experience. And my recommendation is your administrator or CEO record a short video about access. It should come from the top. We've made this a safe, easy access for you. Again, post this on your website, on your Facebook, on YouTube, on Instagram. The community will eat it up. Idea number 6, folks, this is genius, if I may say, and it's this. What if every patient on the way out was asked to record a video testimonial? Now, please understand, I'm talking about all this video. I'm not saying you should engage or retain a video production company. Just use your smartphone. It's authentic. And here's the idea. When every patient is being discharged, whether it's an inpatient experience or outpatient, say something like this. We sure appreciate your choosing us. We value your coming back. Would you mind if we recorded a short 30-second video of why you came back? Now, I predict you're going to find almost everybody's going to say yes. Not all, but most. And what happens is when they record that video, guess what? They're now becoming a fellow campaigner with you. If I recorded a video for you, I'm going to tell everybody about it. And it will have a Hawthorne effect on all caregivers. Every caregiver knowing that these videos are going to be requested, nobody's going to want to be the reason that a patient said no. Thirdly, once you post this on your website and all the various locations, it's going to go viral. I will tell everybody, they will tell everybody. And I'm not talking about 10 or 20 videos. I'm talking about hundreds of videos organized by category. And again, no need for expensive production. Do the video, add the person's name, make sure they sign a consent agreement. And by the way, we have charters for every one of these projects all worked out. All you got to do is say go. Mark Zuckerberg, the billionaire boy founder of Facebook, said, nothing influences people more than a recommendation from a trusted friend. A trusted referral influences people more than the best broadcast language. A trusted referral is the holy grail of advertising. A couple of numbers for you, which I think you're going to find interesting. 84% of consumers say they either completely or somewhat trust recommendations from family and friends about products and services. No surprises. But here's the shocker. 88% trust online reviews written by other consumers as much as they trust family and friends. But here's the catch. You have 100% control over your influence with a patient while they're under your roof. Once they're gone, it's 0% until now. Because if they're leaving with a testimonial with you that you can share with others, their legacy will live on. Outreach idea number 7. What we'd like to do is recommend that you launch a community customer service academy. Now, here's the deal. If you're struggling to get patients back, what's everybody else doing? Retail stores and restaurants and manufacturing plants and businesses of all kinds are all struggling with the issue of in-person care, and they're all trying to work around it. What we've done is we've put together a 2-hour presentation called Winback Every Single Customer. And it's for the business leadership of your market area, in your community, in your city, in your county, your counties. We would deliver it for you. We would partner with you on delivering it. It'd be a fantastic opportunity to tell your story about customer service while you're educating for free the entire business community. In other words, let's give it away. We've got an exciting educational program designed, much of it based on my book, Satisfaction Guaranteed, How to Satisfy Every Customer Every Time. Now, while we're on that subject, Boston Consulting Group did a study of 7,000 patients across the US and asked them, what would it take to get you to come back for elective surgery? Providers can influence up to 50% of the conditions affecting a patient's willingness to reschedule elective healthcare based on your facility being certified as COVID-19 free. Well, I checked. There's nobody certifying anybody as COVID-19 free. So what we've done in partner with Survey Solutions and the good folks at ADCO in Illinois is we've created a website called hospitalsafe.com. Very soon, we're going to open it up. And for our partners, those organizations we're involved with, you'll be able to go to that website, check off your compliance with CMS, CDC, state, local, national regulatory requirements, and receive a certificate that says proudly COVID-19 compliant. Not just for your hospital, but for medical clinics and home health and long-term care and ambulatory surgery clinics and more. So we think this is an awesome way to send out a message. One of our first partners said, I'm taking a billboard with a physician holding this certificate. People need to know you're safe. In fact, you're the safest place in town. Now, we did raise skepticism about advertisement, but advertising in some cases does work. So we've created some sample templates that we'd like to give to you of how you can run ads in your local daily newspaper and weekly newspaper and magazines about we have a safe 5-star healthcare experience waiting for you. In addition, we've partnered with the good folks at ADCO who are very engaged in providing healthcare patient experience surveys. And at our annual conference, I asked Julie Russell, the president, to deliver an education program called Make Google and Rate MDs Your Ally and Friend. And she did a marvelous job. It exceeded my expectations. Well, I've asked her to put together our 10th outreach project, and that is a turnkey social media campaign that you can choose from, available a number of options. And again, we recommend you take advantage of this. So when we think about these 10 projects, easy, safe access, number 1. Number 2, sentence starters for safe education. Number 3, innovative social media safety videos. Number 4, mini documentaries. Number 5, Why I Came Back, testimonials. Number 6, the Community Customer Service Academy. Number 7, the Hospital Safe Compliance Certification. Number 8, a Community Winback print marketing advertisement. Number 9, social media marketing campaign. And number 10, Safety Ambassador Outreach Project. There you go. Which one spoke to you? Which ones would be relevant and valuable and helpful for your organization?